So, how much is your peace worth? How much is your mental wellness worth? Well, let's talk about the cost of mental health care. I'm Kathy Shorman. I'm the owner of Monarch Therapies. I'm a licensed clinical professional counselor, a trauma expert, and a certified neuro-linguistics programming uh, practitioner. So let's get into it. In my practice, we accept insurance. We accept a lot of different types of payments. And one of the reasons behind that is in a past life, I was a leader in managed care. So I understand a lot of the nuances of insurance. And there's a lot of practitioners that don't accept managed care, and that's okay. That makes sense for them. So let's talk about when can you use your insurance and what does that even mean? So insurance versus private pay. When a clinician is contracted with insurance, that means that they are going to make sure that what you're talking about meets something called medical necessity. And there's a lot of rules and guidelines that I won't bore you with. However, in order to use your insurance, just like when you're getting a physical health treatment, your therapist, psychologist, doctor needs to make sure that the care they're providing for you meets those medical necessity guidelines. Your insurance might require you to meet a deductible. It might have a copay. As a consumer, it's up to you to really check in with your insurance, and they can help you find a provider that's contracted with them and help you understand your benefits. Your provider is subject to their contract, and you will never be charged more than what their contract rate is, um, as long as what you're doing is meeting medical necessity. Cash rates vary. They vary provider to provider. They vary state to state. They vary modality to modality. So it's important that if you are a consumer of mental health care that wants to use your insurance, that you understand the differences and that you check with your provider. Something else I want to talk about, though, is employee assistance. So a lot of employers offer something called EAP, or an employee assistance program. These are benefits provided to you for free. You don't have to pay for any of it. And a lot of times that will include counseling, short-term counseling that you are required to call and get an authorization for. And it's anywhere from like 2 to, so I've seen sometimes 10 or 12 sessions for specific mental health or relational or family concerns. You should check with your employer to see if that's available to you, because again, it's absolutely free to you as the employee, and your counselor, your therapist, they're going to get paid. So why not check that out? If none of those are available to you, I want you to know that there are a lot of resources out there, a lot of free resources and low-cost resources. Your community mental health center. There's a community mental health center available to every county, at a minimum. It might be not as close to you as something else, and the community mental health centers are there to serve all of the members of their community. So you can start there to seek care. If you are not sure where you or your loved one might need and you need help right then, there's also a national hotline, 988, that will be able to connect you to all of your local resources. So paying for mental health care doesn't need to be a burden. Just like your physical health care, it's important for you to take the time to not only receive the care, but also feel good about how the cost of care is intersecting with your other life needs. So, if you have any questions or you're not sure how to navigate the system, reach out to us. Go to our website, send us a message. Be happy to help. And as always, I see you. I love it. I'll talk to you later.